Radiology, Introduction to Hepatobiliary Scintigraphy and the Principles of Gamma Camera Imaging. Welcome fellow medical students and aspiring radiologists to today's lecture on hepatobiliary scintigraphy and the principles of gamma camera imaging. In this session, we will delve into the details of this important diagnostic tool used in the evaluation of hepatobiliary pathology. Let us begin our exploration into this fascinating subject. Hepatobiliary scintigraphy, commonly known as a HIDA scan, hepatobiliary aminodeacetic acid scan, is a nuclear medicine technique used to image the liver, gallbladder, bile ducts, and intestines. The procedure involves the administration of a radiopharmaceutical, which is then taken up by hepatocytes and excreted into the biliary system. The gamma camera, a vital component of this imaging modality, captures the emitted gamma rays and produces images that aid in the diagnosis of various hepatobiliary disorders. Technetium 99 meters, 99 mtc, labeled aminodeacetic acid derivatives, such as mebrafenin or disophenin, are commonly used radiopharmaceuticals in HIDA scans. These agents are hepatobiliary specific and have high affinity for the liver. They are preferably administered intravenously, and their uptake by the hepatocytes allows visualization of the liver, biliary tree, and gallbladder. The HIDA scan is performed in a specialized nuclear medicine department under the guidance of a radiologist or nuclear medicine specialist. After the intravenous administration of the radiopharmaceutical, sequential images are acquired using a gamma camera. Dynamic imaging is performed, focusing on the hepatobiliary phase, which usually begins approximately 60 to 90 minutes after injection. This delayed imaging allows for better assessment of the biliary excretion and visualization of any abnormalities. A normal HIDA scan demonstrates prompt uptake of the radiotracer by the liver, followed by excretion into the biliary system, visualization of the gallbladder, and subsequent emptying into the small intestine. The presence of these findings indicates normal hepatobiliary function and excludes significant pathology such as biliary obstruction. Quantitative analysis of HIDA scan images can provide important information regarding hepatocellular function. Parameters such as hepatic extraction fraction, time to peak activity, and bile transit time can be calculated to assess liver function and detect any abnormalities in hepatocellular uptake and excretion. One of the crucial applications of HIDA scan is the detection and differentiation of biliary obstruction. In cases of obstruction, delayed or absent visualization of the gallbladder or biliary tree can be observed. Additional imaging techniques, such as cholescintigraphy, may be employed to further characterize the nature and level of the obstruction, aiding in proper patient management. HIDA scan plays a pivotal role in differentiating biliary atresia from neonatal hepatitis, which can present with similar clinical features. In biliary atresia, the scan typically reveals absent or delayed visualization of the gallbladder and biliary tree due to the complete obstruction. Conversely, neonatal hepatitis may show normal or mildly abnormal findings, with preserved hepatobiliary function. Advancements in HIDA scan technology have led to the development of advanced techniques for quantitative analysis of bile excretion. Dynamic acquisition, time activity curves, and region of interest analysis are some of the tools utilized to provide detailed assessment of hepatic function and bile excretion, aiding in the characterization of various pathological conditions. The evaluation of cystic duct patency is essential in preoperative planning for cholecystectomy. HIDA scan can assess whether the cystic duct is patent or obstructed, helping in the decision-making process and choosing appropriate surgical management. If the radiotracer passes freely into the gallbladder, it indicates patent cystic duct, while obstruction may be suspected in the absence of radiotracer in the gallbladder. HIDA scan can be valuable in the evaluation of post-cholecystectomy complications. It assists in identifying complications such as bile leaks or retained common bile duct stones. The absence of radiotracer in the biliary system post-cholecystectomy raises the suspicion of bile leakage, while delayed visualization may indicate the presence of retained stones. HIDA scan can also be employed to assess bile reflux, a condition characterized by the retrograde flow of bile from the duodenum into the stomach and esophagus. This assessment involves prolonged dynamic imaging, allowing the visualization of retrograde flow of bile from the duodenum towards the stomach or esophagus. Such findings aid in the diagnosis and management of patients with suspected bile reflux. Recent advancements in HIDA scan technology have further enhanced its diagnostic capabilities. Improvements in gamma camera resolution, image acquisition speed, and quantitative analysis software have reduced acquisition times and increased accuracy in diagnosis. These advancements continue to shape the field of hepatobiliary imaging, making it an indispensable tool in clinical practice. In conclusion, hepatobiliary scintigraphy utilizing gamma camera imaging provides valuable insights into the functioning of the hepatic and biliary systems. From the principles of gamma camera imaging to the interpretation of normal and abnormal findings, this modality holds immense importance in the field of radiology. As you continue your journey in medicine, keep in mind the significant role hepatobiliary scintigraphy plays in the diagnosis and management of various hepatobiliary disorders.